Hi, I'm a postdoctoral fellow in clinical psychology at Stanford's Sleep Health and Insomnia program, and I've also seen and treated hundreds of different patients across a number of different sleep disorders like insomnia disorder and nightmare disorder, and I also happen to have written a book on treatments of insomnia. It's called The Insomnia Paradox. And in this video, I'm going to talk about the top 10 lessons that I found most helpful for my patients to really support them in getting out of the insomnia trap and getting them back on track. So lesson number one is to not cast a wide net when you're struggling with insomnia. And what I mean by casting a wide net is that people with insomnia are kind of thinking to themselves, well, it takes me like an hour to fall asleep and I'm up in the middle of the night for a couple of hours, so I should spend more time in bed. Like if I need my 7 or 8 hours and I'm up for a couple hours, then I should spend 10 or 11 hours in bed. And although this makes very reasonable sense on paper, this can actually sabotage our sleep. So the analogy I like to use with my patients is the pizza dough analogy, where essentially, let's say you have 6 inches worth of pizza dough, but you're stretching that out into a 9 or 10 inch pan. What would happen to the pizza dough if you were to do so? Well, obviously the pizza dough would become very thin. If you stretch it out, there might be holes in the middle of it. And the same thing can happen with our sleep. So if we're sleeping 6 or 7 hours, but we're stretching that into a 10 or 11 hour window, our sleep also becomes very light, and there's going to be a lot of awakenings in the middle of the night. And as a result, the sleep is going to be overall quite unrefreshing, and we're going to have less time during the day to be awake and active and build up our appetite for sleep, creating this sort of insomnia trap. So the recommendation would be to try to keep to a pretty close time in bed window to how much sleep you're actually producing. So if you're sleeping currently about 6 hours, then you would want to spend about 6 hours time in bed. And the question that people might think about is like, well, if I were to do so, then I wouldn't be able to get enough sleep because I'm still taking so long to fall asleep. And the thing is that even if you did kind of initially have a bit of that trouble, over time, you're going to build up more and more appetite for sleep. You're going to have to pay off your sleep debt at some point, so that by doing so, by keeping how much time you're spending in bed relatively close to how much you're sleeping, you're actually setting yourself up for success the next night. Lesson number two is that not everybody is an 8-hour sleeper. We all have our own unique individual sleep needs. Some of us need a little bit less, some of us need a little bit more, and it's important to kind of recognize that if you are trying to strive for 8 hours, even if you're a 6 or 7 hour sleeper, then that in and of itself can create insomnia symptoms, because you're trying to force yourself to sleep 8 hours when your body can really only produce 6. So at some point, you're going to be awake in the middle of the night for a couple hours, or the sleep itself is going to be quite unrefreshing. Kind of like similarly, again, with the pizza dough analogy, that you have 6 inches worth of pizza dough, but you're stretching that into an 8 or 9 inch pan. And lesson number three comes from a quote in my book, which is the more that we chase sleep, the further away sleep gets. And this comes from the idea that sleep is fundamentally an automatic, effortless process. And when we try to force ourselves to sleep, when we put effort into the act of sleeping, it can actually make it much harder for us to sleep, because the sort of arousal and frustration and anxiety that comes from wanting to sleep, from white knuckling sleep to come, can actually make us feel more and more anxious, which is incompatible with being able to sleep. And the exercise I like to use when it comes to this particular idea of sleep effort is this finger trap exercise, where I showcase that when we try to put pressure into the idea of needing to sleep, it's kind of like trying to pull out of this insomnia trap or finger trap, and we actually feel more and more stuck and frustrated and scared. However, if we can kind of come to terms with the fact that we're struggling with sleep right now and actually accept the fact that we're awake, it's kind of like then pushing our fingers together to be able to then get out of the trap. So by getting out of this sort of idea that we need to put effort into sleep, and then instead allowing sleep to just come naturally to us, we can get out of the trap and back on track with our sleep. And going along with this idea of sleep effort, then, our lesson number four is that rest is second best. That when you're in bed, your ultimate goal is simply to rest. That if sleep comes to take us away, that's awesome, but otherwise you're succeeding just by virtue of being in bed, not frustrated, not anxious, but protecting that time for nourishment and for rest. Lesson number five is to try not to compensate for a poor night. So oftentimes the very reasonable response that someone does to kind of navigate their insomnia is to try and sleep in if they can, go to bed early the next night to try and catch up on some sleep, reduce their activity, really kind of pay attention and monitor all their activities and their performance, and kind of get a little bit more anxious as a result. But all these things, while very reasonable in the short term, actually maintains our problem in the long term by increasing our anxiety about sleep, by reducing our appetite or ability to build up appetite in subsequent nights, as well as affecting our circadian rhythm by sometimes sleeping in or going to bed early, or really creating some variability in our schedule. So if you happen to have a poor night, do your best to still wake up around the same time and go about your day as much as you can as you normally would, because that is actually going to be the key to long-term sustainment of your overall sleep health. Lesson number 6 is that light is not as big of a deal as people think it might be. So oftentimes a lot of patients come to me and say they're really worried about the blue light, they're worried about having any light exposure at night, and it's actually not as big of a cause for concern as people might think it might be. So when we think about evening light, we think about a couple things. The first thing is that if you had some relative light exposure, sunlight in the morning, the relative amount of light you experience at night because of TVs or cell phones or things like that is relatively minimal. So it's not going to significantly impact your circadian rhythm, especially if you got some sunlight during the day. And a lot of the research is a bit overstated because oftentimes these studies are lab based, meaning that they're literally controlled settings where people are staring at bright lights for hours on end after being kind of in a dark period or a dark room. So it's not really particularly connected to what things actually look like in the real world. And the second thing is that the effect size, how strong the magnitude of effect of the light, is actually relatively small. One systematic study found that the delay in bedtime was just about 5 minutes maximum after being shown with bright light for hours on end. So the amount of kind of impact it really has on our day to day, again, relatively minimal, especially if you got some sunlight. So totally fine if you want to watch some TV or a rerun of Friends at night. Lesson number 7 is to do our best to associate the bed with sleep rather than wakefulness. And the story that I often tell my patients is the story of Pavlov's dog, where essentially Pavlov was a experimenter where he would often ring a little bell while providing his dog some food. And over time, one thing that Pavlov realized was that the dogs would begin to salivate just by virtue of the ring of the bell, even when there was no food around, because it had created something called classical conditioning, where the dog had associated the ring of the bell with food. And the same thing can happen to us when it comes to the bed. If we're constantly in bed, engaging in wakeful activities like playing on our phones or being worried about not being able to sleep or frustrated or ruminating or worrying, then the bed becomes associated with all these wakeful, non-sleep compatible activities. So we want to make sure that the bed in the bedroom is generally associated with rest and relaxation, where most of the time you're spending in bed is for the sake of sleep. Lesson number 8 comes from the idea of setting our circadian rhythm every day by waking up around the same time every day and then getting some sunlight, because these activities, regular bed and wake times, as well as getting some sunlight, really help set our circadian clock to kind of tell us when we should be awake and when we should be asleep. And oftentimes what can happen if we have very irregular schedule is that it can create something we call jet lag symptoms, where you might notice that you're feeling sleepy at certain times or weird times and feeling kind of just off in general. And this can happen both by virtue of traveling to different time zones and having a very irregular schedule in our sleep-wake schedules. So the best practice is to kind of go to bed and wake up around the same time every day, as well as getting some sunlight in the morning. Lesson number 9 is to make sure that you have a proper wind down at least 30 minutes to an hour before bed. And the reason why this is important is because even if we have high sleep appetite, even if our circadian rhythm is strong, we can still be quite awake if we are feeling kind of wound up, if our arousal levels are quite high. So one thing that can be quite helpful is to do something at night that is relaxing, especially for you, whether that's listening to music, watching TV, watching a rerun of something you quite enjoy, or doing something else, spending time with your partner, for example, something that you know kind of calms your mind, quiets your mind, as well as relaxes your body, so that when you do go to bed, you have a high amount of sleep pressure and appetite, a strong circadian rhythm, and then also generally low arousal. And lesson number 10 is that you can function a lot better than you think you can, even if you're struggling with insomnia. A lot of the research indicates that, objective and subjective disparities are found when it comes to people estimating how good they're at doing something when they're having a poor night versus how they actually do. And oftentimes what happens is that people worry so much about their performance that they get more anxious about the next night, which makes it even harder to sleep well, and it creates this vicious loop. So one thing that can be helpful is to remind yourself of your resilience, remind yourself of your successes in spite of the fact that you're struggling with sleep problems, because that can help tone down some of the anxiety and then allow for a better night forward. And it's probably true too, that even though you've been struggling with insomnia for such a long time, that you've been successful in so many different areas of your life, and reminding yourself of your successes can be one pathway towards freedom. And that's it. I hope you found these lessons helpful, and thank you as always for watching. I'll also list out some kind of other videos that you can watch if you're interested in learning more about treatments of insomnia without medication. Otherwise, I'll see you next time. Bye bye.